8 out of 10. 8 out of 10 patients with type 2 diabetes are primary prevention patients. Evidence from a cohort study that included over 34,000 patients with type 2 diabetes and no cardiovascular disease at baseline found that after a median follow-up of 5.5 years, 82% of patients had not yet had a cardiovascular event. Type 2 diabetes significantly increases the risk of developing cardiovascular disease, including heart failure. Patients with type 2 diabetes had a 2 to 4-fold increased risk of vascular disease and heart failure compared to patients without diabetes. A prospective study evaluating clinical and echocardiographic characteristics of individuals with type 2 diabetes and without overt cardiac disease found that 68% of patients who had type 2 diabetes for 5 years showed signs of left ventricular dysfunction. Controlling glucose alone has not been shown to reduce the risk of heart failure in patients with type 2 diabetes. Several international guidelines recommend intensifying treatment in patients with type 2 diabetes and at high risk for CV outcomes to reduce the risk of major adverse cardiovascular events, hospitalization for heart failure, or cardiovascular death. Approximately 40% of patients with type 2 diabetes develop chronic kidney disease. Significant kidney damage is not usually seen until late in the course of diabetic nephropathy. The European Society of Cardiology and American Diabetes Association guidelines recommend intensifying treatment in patients with type 2 diabetes to reduce the risk of CKD progression, end-stage kidney disease, or renal death. Take action today while cardiovascular and renal protection may still be in your control.